I've learned that achieving results takes two things. It takes a technical ability to understand when things are moving forward and how you plan for it and measure it and monitor it. But it also takes understanding about beliefs and behaviors and what lights passion in people. And I also understand that it takes time, it takes energy, and constancy of purpose. You know how they say business is about location, location, location if you want to be successful? Well, it's the same thing with improvement and spread. It's leadership, leadership, leadership. And so leaders have to change the way they think about their job. It's no longer solving problems. It's about motivating the passion within people to make a change and know that that change is possible. It's about asking people to see things differently and measure things differently. Measure improvement over time rather than whether or not we're hitting the mark. And measure whether or not, from the voice of the patient, we're making a difference for them. Because really, we're about healing people and health. And if we can't help people get healthier as individuals and help populations get healthier, then leadership has failed. Leadership also has to role model the way. So we need to move from managing budgets and managing projects. We need to get out into care delivery and understand what's going on there and help people understand how we can overcome the barriers together. We also have a responsibility to share what's happening in other places with one another. We're the connectors. One person might be struggling with a problem, and another person might have solved that, and we know about that. So our job is to be agents of spread and knowledge and to put people together who have interests in solving the same problems. I think I would have them step back and involve a number of people in the planning process. It used to be, I thought I needed to put a good, strong plan together and try to march my way forward, and that's not exactly what happens with spread. So my advice is to think about three things. One is, when you think of spreading something, first assess whether or not it's a high priority for the organization. What measure does it move? What does it do for the patient? Is this important and meaningful? Once we understand that, then the second is to assess whether or not a practice can actually move. And then the third would be understand now, with everybody involved, whether or not they're ready to receive, and help them become more ready to receive the practice and to motivate change and improvement together.